primary health care for everyone. This is an immense challenge in Tajikistan, especially in the mountainous areas of the Pamir region and Katlan.
Man Sharipova Saltanat, Hamshirai Tibi Oilavi.
The Swiss Agency for Development, SDC, is supporting the establishment of a nationwide system of family medicine in close cooperation with the government of Tajikistan.
من دولتبکوف مرادبک طبیب اویلوی هستم.
The Tajik family medicine model has met with success. One reason is because slowly, more and more young doctors are choosing to specialize in family medicine.
من شعله و سبزینه طبیب تیبی اویلوی هستم.
Sabzina Sholieva is one of the new generation of family doctors. After initially specializing in cardiology, she retrained 7 years ago. Since then, she has been working in a regional healthcare center.
این کسب به من خیلی هم معقول است چون که این کسب قریب که همه اختصاص‌های طبیبی رو در بر میگیرد و دومش این خدمت رسانی به مردم از وقتی تولد شدن همون کودک و همه اعضاهای عائله رو میتونیم گفتن تا وقتی فوتشون به آنها خدمت خود رو میرسانیم.
Up until a few years ago, accessing medical services was very difficult for many people here, the poorest country in Central Asia. This is now set to change, with a healthcare reform programme establishing a nationwide system of family doctors. The SDC supports this reform, both financially and by fostering knowledge exchange among doctors and the general public. Murodbek Avladbekov qualified as a family doctor in 2011. His patients live in a number of villages in a remote valley in the Pamir Mountains. The family doctor works alongside his nurses at the small practice. Thanks to the project, they now have basic diagnostics devices. Dr. Marubek has the equipment he needs for day-to-day medical care, earning the trust of his patients. However, the family doctor spends more than half of his working time on home visits. He usually travels on foot. He doesn't have a car. Traveling takes a lot of time, but it's worth it. The family medicine system is a blessing for the people here and a huge improvement on the past.
مردم ما پیشتر خیلی بودن عذاب میکشیدن همینجا به رایون و به دیگر طرف های قدر روی دروازه و یا صرف میکردن خرجه میکردن حالا تیبولی و یا کم خرج صفت نوک همش سری وقت یاری کمک تیبی را میگیرن در خودی خانه‌اش.
But treating patients is only part of the family doctor's work. Together with the nurses and community volunteers, he also provides educational and outreach services. The people here are lacking in information about diseases, hygiene and prevention. Yunus Abdullayev is one of the volunteers. He regularly attends courses on basic medical subjects. He passes on this knowledge to the villagers.
بسیار خوب است که من حوزه سمینارها در اینجا بسیار گذشته ایستادم مردم دیها بسیار کسانی از بسیار نمودی من 25 از آگاه هستند.
مثلا این کسانی هایی که بسیار چی میکردن مثلا این کودک‌ها بسیار شکم را میشینن و بعدش همین کسانی ها استوسا کم شدن. امی سبب یکم کساله همین جویبارهایی که افلوس هستن آنها رو توضیح میکنیم همه وقت.
It is particularly challenging to provide medical care in remote areas, where even the closest family doctor is far away. Here, the nurses are the main pillars of the new family medicine system. Saltinat Shoripova. She lives and works in the village of Bashgumbez in the Pamir Highlands at an altitude of almost 4,000 metres. As a healthcare specialist, she works mainly with women, expectant mothers and infants, and has done so for the past 35 years. Her patients also include nomadic women whose communities have set up yurts in the vicinity. Saltinat Sharipova takes care of expectant mothers and monitors the infant's health. This is an important job because both maternal and infant mortality rates here are above average. But as a general nurse, she also deals with all sorts of patients.
Здесь это распространенные больные, это только это гипертонические больные у нас. Это высокогорье, если вот он диету не соблюдает, в жарении это все много покушает, после этого гипертонический бывает.
The greatest need for information is in healthy eating and hygiene, basic information about the causes of disease. But not only that. This afternoon, the focus is on new mothers and their babies.
Грудное вскармливание тоже мы научили, как грудь кормить ребенка, как его разговаривать.
Breast cancer is another important issue for women here. The volunteers and the commitment they show are crucial to the new family doctor system. In the sparsely populated valleys of the Pamir Mountains, volunteers also provide another type of help. For example, many families in the remote villages cannot afford to deal with a medical emergency. The programme is planning to help out with a joint fund as a sort of insurance. Initially, this idea encountered much resistance and mistrust. Would the funds be properly managed? Today, all households participate, paying in around half a Swiss franc each month. In return, the fund also pays out for transporting patients to a medical centre and now also for certain medical tests. Sound financial management of the local and regional healthcare centres is just as important to ensure that investments have a long-term impact. Switzerland therefore insists that managers should be appropriately trained and business plans introduced.
Business و نقشه با ما فایده آورد که در رفتی کار با این پلان بازی بودجت ما پورا معلوم است و ما این رو از روی اهالی با بانک‌ها و مرکزهای سلامتی جدا کرده میتوانیم و این رو اونها همچون ثمرناک استفاده بردن میتوانند.
It is the patients who benefit the most from a more efficient utilisation of the relatively modest finances available. Another advantage for the local population is the expanding network of doctors and the modern technical aids now available to family doctors. Apart from regular discussions with specialists around her, family doctor Sabzina Sholieva also has the possibility of seeking advice by video conferencing with specialists in the closest hospital.
دورونی مثل مرکز قطعی مشورت میگذارونیم که متخصص بود چقدر میفهمونه ما با.
Here, neurologist Zubaida Akdodova is assessing whether the patient should undergo computer tomography, which would mean her having to travel. The specialist recommends first trying a different medication and an alternative therapeutic method. With this project, SDC has been supporting family medicine in Tajikistan for 9 years. The health reform programme places patients at the centre. It must also prove to be financially viable and sustainable. The reform has led to significant improvements in the medical care available to the population. Many people are now better informed and can take more responsibility for their own health. However, achieving the goal of a healthy life for all by 2030 will take further work and continued investment by the government, local communities and the people themselves.